So, good afternoon, everybody. My name is Eszter Virág-Tulassay, and I would like to present my PhD thesis. I am working as a resident doctor at the Department of Orthopedics of Semmelweis University, and I am a first-year PhD student. My vision is that in the future, shoulder dislocation will not be a long-term limiting injury for young people. So my mission is finding the best choice therapy for each patient with anterior shoulder dislocation. Because of that, I have two specific goals, and I would like to present my first one, that investigating the safety and the efficacy of different therapies for acute anterior shoulder dislocations. Shoulder dislocations are about the 50% of all joint dislocations, and 97% of these being an anterior one. Acute shoulder dislocations are associated with a lot of pain and a lot of tissue injuries, but the problem is that the most appropriate treatment option is not clear yet. The question is that the conservative treatment is enough, or we need a surgery like soft tissue surgery that we called Bankart. There are currently no international recommendations for appropriate intervention, so we would like to provide evidence on this problem. Our clinical question is really simple. Which therapy is the best for the patients with acute anterior shoulder dislocation? So our people is patients with acute anterior shoulder dislocation, and we would like to compare the immobilization in internal rotation like this, immobilization in external rotation like this, and the Bankart surgery. It will be a network meta-analysis, and we have two main outcomes. The primary outcome is the safety, like redislocation rate, the subluxation rate, and the instability. And the second one is the efficacy, like return to sport and scores. Our hypothesis is that Bankart surgery has the highest efficacy and the lowest risk for complications for acute anterior shoulder dislocation. If we have true, we can help for the surgeons to find the best choice therapy for each patient. You can see my systematic search that I made in 3 databases and my search key. And after the literature selection, we have 35 eligible full texts. And now I would like to present my results. The first one is the redislocation rate after the therapy. You can see 2 endpoints with maximum 24 months follow-up time and with more than 24 months follow-up time. It's because the arthroscopic Bankart repair has the highest redislocation rate after 2 years. On the network plot, you can see nodes, that means the interventions, and the size of the nodes means how many studies we have about the interventions. And the connection between the nodes means how many studies work for each comparison. You can see that we have a missing connection between the arthroscopic Bankart repair and the immobilization in external rotation with more than 20 months follow-up time. That's because the number of the studies in this comparison was just 6. On the league table on the right corner, we can see the direct comparisons, but we have indirect comparisons too. So the network pool contains both of them. And we can see that the arthroscopic Bankart repair has 0.18 times less chance for the redislocation than immobilization in external rotation, and 0.08 times less chance than immobilization in internal rotation. The immobilization in external rotation has 0.45 times less chance for the redislocation than immobilization in internal rotation. The Sukra test shows that which therapy has the highest possibility to be the best, and the p-score is from 0 to 1. And we can see that arthroscopic Bankart repair has the highest p-score, almost 1. So this is statistically significant and clinically really relevant. With more than 24 months follow-up time, we can see the same, that the arthroscopic Bankart repair has better results than immobilization in external rotation and immobilization in internal rotation. And immobilization in external rotation has a better results than immobilization in internal rotation. And the Sukra test shows the same, that arthroscopic Bankart repair has the highest p-score, and that means that arthroscopic Bankart repair has the highest possibility to be the best therapy. The second outcome is the subluxation rate with maximum 24 months follow-up time. We have just one endpoint because we don't have enough data to make a second endpoint, but you can see that the network plot is full. And on the league table, we can see that arthroscopic Bankart repair has 0.18 times less chance for the subluxation than immobilization in external rotation, and 0.40 times less chance than immobilization in internal rotation. And the immobilization in external rotation has 0.78 times less chance than immobilization in internal rotation. The Sucre test says the same, that arthroscopic Bankart repair is the best. The p-score is almost 1. The third outcome is the positive apprehension test with maximum 24 months follow-up time. The apprehension test is a physical examination that the shoulder is unstable or stable. We have a missing connection because the number of the studies in this comparison is just 4. But on the league table, we can see that arthroscopic Bankart repair has 0.06 times less chance for the positive apprehension test than immobilization in external rotation, and 0.04 times less chance than immobilization in internal rotation. Immobilization in external rotation has 0.67 times less chance than immobilization in internal rotation, and the Sucre test says the same, that arthroscopic Bankart repair is the best. The fourth outcome is the return to sport after the therapy. You can see that we have 2 endpoints with maximum 24 months follow-up time and with more than 24 months follow-up time. And the results is really clear. Arthroscopic Bankart repair has the highest p-score, is almost 1, and it's clinically relevant and statistically significant. The fifth outcome is the subjective scores with maximum 24 months follow-up time. On the forest plot, you can see the standardized mean difference, and we can see that the network estimate is consistent because the direct and the indirect estimate confidence interval is in the same level. But interestingly, the p-score is different. We can see that the immobilization in external rotation has a highest p-score than arthroscopic Bankart repair. The difference is small, but the immobilization has a highest p-score. Of course, we have strengths and limitations. The strengths that we used only randomized control trials. Our participants was age-matched, and it's a complex and a comprehensive analysis. The limitations are that a low number of the participants, few publications to include, and mixing data for important variables in some studies. But our conclusion is really clear and really strong. Bankart surgery has the lowest redislocation rate and therefore the highest safety after 24 months follow-up time. So the implication for practice is that maybe we should forget the immobilization in internal rotation after the acute anterior shoulder dislocation, and we should focus on the surgery therapy like arthroscopic Bankart repair. And the implication for research is that further prospective data collection is needed to evaluate the efficacy and safety of different available therapies. I am working on my manuscript, and you can see my journal selection. And now I would like to present my second topic, that investigating the safety and the efficacy of open Latagé surgery in recurrent shoulder dislocation. As I mentioned before, the shoulder is the most commonly dislocated joint. And without any intervention, the recurrence rate is really high, almost 100% in the younger populations. And the problem is the same, that the most optimal treatment option is not clear. The question is, the soft tissue reconstruction is enough like Bankart surgery, or bony correction of the glenoid is needed like open Latagé procedure. So there are currently no international recommendation for appropriate intervention, so we would like to provide evidence on this problem. Our question is that which therapy is the best for patients with recurrent anterior shoulder dislocation. The population is patients with diagnosed recurrent anterior shoulder dislocation. The intervention is the open Latagé procedure, and the comparison is the Bankart surgery. And it will be a meta-analysis. We have the same 2 outcomes as in the first project, the safety and the efficacy. And our hypothesis is that Latagé surgery has the highest efficacy and safety in recurrent shoulder dislocation. And if we have true, we can have for the surgeons and we can have for the patients, so everybody win. It's my preliminary research and my preliminary research key. And to summary, we think that we found the best choice therapy for the acute anterior shoulder dislocations. So our aim is the same for the recurrent shoulder dislocations too. So thank you for your attention, and as we learned before from Peter Hegyi, hope is not enough. Thank you very much.
So a short question. So in your first meta-analysis, you showed that the internal rotation is actually the worst version. So from the clinical or anatomical viewpoint, what could be the difference between external and internally rotated position? Like, why is it so bad compared to the external one?
internal immobilization is like this, and external is like this. And if we think in this position, the humeral head and the glenoid is closer than in the internal rotation. And because of that, the healing is easier and better. So this is the reason why the external rotation is better than the immobilization in internal rotation.
So it sounds like it was a stupid idea from the beginning, right? The internal
Sorry,
rotation.
it's just anatomy.
Okay, thank you.
I would like to ask a question as well regarding the recurrent shoulder dislocations. Is there a current guideline recommending which kind of surgery is superior than the other? Or not?
No, we don't have guideline. Because of that was the idea that we should make a meta-analysis, because we don't have an international guideline.
And that's only for the recurrent shoulder dislocation or for the shoulder dislocation?
No, it's true for the acute and the recurrent shoulder dislocation too. So we have some big bases internationally, and the Germany makes Latagé, the American makes Bankart, so everybody makes different therapies. So we would like to make an international protocol that make this situation clear.
Right. Thank you.
Thank you very much.